Hello beautiful people, it's Dr. Ahmed. We're back again with another video. Today we're going to be doing the Ellanse collagen stimulating treatment on the fabulous Hezel. Sometimes when people don't want to go under the knife, they think they need a lot of dermal fillers to give themselves a non-surgical facelift. However, they forget about something very important, which is the skin quality. And this is why I think Ellanse is a great treatment for Hezel. So Hezel, when you look in the mirror, what are the things that catch your eye?
Well, hair's like drooping now, getting sagger, and I've got a lot of lines here.
Yeah. So it's more kind of the skin quality and the elasticity, isn't it? So when we pinch the skin, we can see little fine lines going through things.
Yeah.
I think obviously you've taken care of yourself over the years. I can tell you've really taken care of things. But as time goes on, we lose about 1% of our collagen production every year from the age of 25. So by the time, say you're 50, you've lost about 50% of your collagen production. So he's like, yeah, any treatments done before?
No.
And what made you kind of come in today for treatments?
I'm kind of lacking confidence, and like I'm going away on a holiday and I wanted a little bit of a boost.
Are you going anywhere nice?
I am, I'm going to Dubai.
Ooh, lovely. Are you going with family or friends?
I'm going to visit my son who lives out there.
Oh, lovely. So I'm sure he's going to be very happily surprised with the treatment and the results by then.
I hope so, I'm pretty sure he will be.
You touched on quite a sensitive point about confidence. Tell me a bit more about that. What's been bothering you specifically and kind of how's that been impacting you in your day-to-day life?
Oh, it's impacted me massively. I don't go out as much now with my friends when they're going out of an evening. I've kind of become slightly reclusive and not socialising nowhere near as much. So I thought, well, I need a little boost.
Yeah.
So it would be nice.
Absolutely. I think Ellanse would be a great treatment for you. As Hezel mentioned, sometimes what happens as time goes on, you start getting a bit of heaviness here because we start losing our cheekbone and the skin elasticity as time goes on, which creates that kind of pre-joweling effect here. So what we're going to be doing today is essentially reintroducing facial structure again. So we're going to be injecting the Ellanse all along the cheekbone, jawline and the mid-face to create an anchoring point up, which gives you similar kind of results but more natural to filler. But the extra benefit here is collagen production, which means that it improves the kind of skin elasticity and skin quality. So you don't just get filled, you actually get better and improves the skin and the underlying structures. Aside from the face, one of the most common areas that people talk about is actually the hands. Because sometimes people will take care of the face, but then they forget about the neck, the décolleté and the hands. So Hezel, you mentioned that your hands is an area that you feel a little bit self-conscious about. Tell me a bit more about that.
Yeah, well, they're looking very old.
What exactly about them looks old?
Well, there's no bounce at all in them. Look,
yeah, the skin gets a little bit thinner there, doesn't it?
Very thin, and when even the slightest knock, I can bruise or cut. I cut easily, a lot easier.
Yeah, so with that, what I'm suggesting is we're going to be doing the Ellanse treatment that will help thicken the skin a little bit. It'll fill in the spaces there so things don't look as visible. Yeah. Obviously, we're going to be avoiding the little blood vessels here and there. And that will show you the results in about 6 to 12 weeks' time. We're going to be using a cannula for this part, and that allows us to actually have one entry point, and then we can put our cannula under the skin and reach different parts of the hand. So I'm just about to mark whereabouts I'm going to be putting the introducer. So I think we're going to go somewhere around here. And then with that allows us to be able to inject linear threads of the Ellanse in different parts of the hand. So now that we've numbed the patient, we're going to be injecting the Ellanse treatment. But obviously before we do so, I need to mark the skin to be as precise as we can. What I'm going to be doing is essentially looking at the different ratios of her face, seeing really where we can do the most impact to improve things. So I'm going to be injecting along the cheekbones there to create an anchoring point up. I'm going to be injecting along the jawline to create an anchoring point that way, to pull things this way, and the same for this section to kind of hide the jowling and the pre-jowling that's occurring here. So now that we've finished the treatment, it's time for the big reveal. Let's have a look.
Oh, I'm so excited.
Are you?
Really excited. Oh my God. Oh, that is amazing. Oh, thank you so much.
What do you see in the mirror?
Oh, God. Oh, a fresh face.
Obviously,
look at my
excuse
cheeks.
the redness. You're a little bit red
Yes,
at the moment. But I mean, if you look at the actual face.
Yeah, oh, look at my cheekbones. Yeah. Oh my God, that is amazing.
And this area here as well. Looks a lot more lifted. You're a little bit red and swollen, and that will subside in the next week or so. But it's normal for things to kind of swell a little bit, and then it'll go back down. Yeah.
Okay. Oh, even my jawlines.
You look fabulous.
Oh, that's great. Oh, thank you.
No worries. Do you have any questions for me at all, Hezel?
No, do I need like, will it be okay to use normal cleanser on my face tonight?
I would suggest tonight just water, and then resume things as normal from tomorrow, but not any retinols. So resume retinols in about 48 hours. No alcohol, no gym, no sauna, nothing like that for 24 hours as well.
Okay.
Try and sleep on your back for the next couple of days, just so the pressure of the pillow doesn't kind of move things.
Okay. All right. So just use water today.
Yeah.
But no face cream.
Not tonight.
Not
tomorrow.
Okay then. All right. Thank you.
No worries at all. Thank you so much for watching, guys. If you want to know more, we'll link it down below in the caption. We'll link that to my website. Please, please, please give us a subscribe, a thumbs up, and follow all my other socials.